And when it comes to healthcare costs in Grand Rapids, watch your wallet. A new study by Grand Valley State University shows that people in GR pay way more for healthcare than people in other parts of the state.
The study showed that patients in Grand Rapids pay on average $3,000 more per hospital admission compared to those in Detroit. Barton Dieters has been talking with experts in healthcare and economics about what's happening here. Barton?
Well, Marlene, Brian, this is the fourth year in a row the study has shown Grand Rapids outpacing the state and national rates for healthcare. There's a lot of possible factors in healthcare costs, but the authors of this study, which included economists at GVSU and Tulane University, eliminated things like lack of health insurance, high labor costs, and other factors. So the question remains, why?
It's one of three things. It's either people in West Michigan are sicker, that the doctors in West Michigan perform more aggressive treatments, or that the prices charged are higher.
There's no evidence to believe people are sicker in West Michigan than anywhere else. But a drive through the city's medical mile displays the state-of-the-art healthcare available here.
All of our hospitals are pretty good. Big ones, little ones, you name it. We've got some good ones, but we got some that are very expensive.
Lodi Zorenstein has been monitoring West Michigan's healthcare industry for decades. He has a stark assessment of what is happening.
There's no competition. Now, I'm not saying that competition is always good, but if you don't have any kind of oversight to put responsibility with that, then you got a bad situation. Economically, we do not have a good situation.
He says people want services close to home, and when there are high-end technologies available, there's a desire on everyone's part to use them. It was in the area of heart care that Grand Rapids most notably outpaced Detroit.
A lot of us are free enterprisers. We've been brought up to believe in that, but the free enterprise system doesn't work in healthcare. We have a very, very skewed market, dominated by one large entity that can pretty much do what it wants since it serves the majority of the community. Spectrum Health, they are the dominant body.
If we get better outcomes, if we have better quality of life after having the procedures that we have here, it may well be worth a little extra money.
Possible solutions, according to our experts, hospital boards that regulate costs better, employers using their influence to pressure providers to lower costs, and patients asking questions and shopping around. Now, we reached out to the hospitals for their comment on the report. They didn't get back to us. We have a link to the entire report at woodtv.com. Live in studio, Barton Dieters, 24-Hour News 8.